So good morning. Everybody can see my slides. My name is Kate Stevens, and I am your host this morning for Good Morning Howard, which is brought to you by the Village in Howard. The Village in Howard is here with the purpose of helping senior citizens across Howard County to age in place and to live our best lives. So we have a lot of activities that we have available for members and for people in the community. On Mondays, we have Morning Meanderings. That's an in-person gathering of folks at Lake Elkhorn, and Coffee with Friends, which is virtual. On Tuesday, the Bridge Group meets in person. And then Tuesday mornings, we have a Tai Chi group. The theme changes from week to week, but that's hosted by Fran Dummett. On Wednesdays, we have a lunch bunch who meets in person and a lunch bunch who meets virtually. So you can tell this is a pretty active group, because on Thursday in the evening, there's also a Tai Chi. It's a repeat of whatever the theme was on the previous Tuesday. On Friday, we have a virtual Mahjong. And then Saturdays, join us at the Lake in Kittymakundi for sneakers and coffee. Again, the group gets together. Folks are welcome to join and walk with everybody. In addition, we have some special programs that come up every month. And if you're interested in these programs, you can go to our website, The Village in Howard. Go to the events calendar where you can get details and register. On May 4th, we have Remarkable Reads. That's my personal favorite. It's not a book club per se. I don't have to dissect the characters. I just tell you if I like the book and what I liked about it. On May 5th, we have a meetup for arts and crafts and projects. They actually meet several times a month, but whether you're crocheting, working on your computer, painting, bring it to our office at the Village in Stevens Forest, and you can just join the group. On May 9th, happy hour is going to be at the Turn House. Please come out and join us. I know some people will go for lighter fare or for dinner, but either way, we'd love to see you. On May 11th, keep up with technology, always changing, always something new to learn, whether it's Zoom or how to project a video on your TV. Joy is setting those up, so please join us for that. On May 16th, My 3 Cents will have a very interesting topic. It's who should have input into what students are taught. This will just be an open conversation. It's virtual, but again, this is something you can register for on our website. We have our annual 50-50 raffle coming up. There are only 300 tickets that will be sold. So the maximum amount to win would be, I think, $7,500, if I'm doing my math this morning. But there are still tickets available for purchase. If you go on the website and look for the 50-50 raffle, you can get details on how you can do that. Now, Good Morning Howard has 2 more programs after this coming up in May. On May 10th, we will have the Howard County General Hospital Community Care Team. These folks take care of us when we're discharged from the hospital. So I think it's really important for all of us to learn about what they can do. There are healthcare workers, health nurses, social workers, but it's the sort of thing before we need it, we would like to know what's available to us and how to take advantage of that resource. On May 24th, I'm reaching out to everybody to tell us what vacations are planned for this summer. Where are you going? Where have you been? Share photos of previous vacations. We're going to be on hiatus for Good Morning Howard so that we can all get out, now that we can get out, and enjoy wherever you've traveled. So please, if you have photos, travel tips, let me know and we'll add that to the program. If you'd just like to come and talk about where you've been or where you're going, we'd love to hear from you. As a reminder, TVIH has Good Morning Howard at 9 o'clock on Wednesday mornings. It's via Zoom. This is open to members and guests. Our sessions are recorded and they can be viewed by TVIH members. So this morning, we're welcoming United States Representative John Sarbanes. He represents Maryland's 3rd Congressional District. He's joined our Zoom this morning. And before we introduce Congressman Sarbanes, I'd like to introduce our host for this morning, Debbie Burgio. Debbie is the executive director of the Village in Howard. She joined us about a month ago. In March, almost 2 months ago, but she's the founder and president of Winter Grace Senior Ministries, as well as our executive director. So Debbie is well known around Howard County. And I'll just put in a little plug. There's going to be a 50+ resource event going on, a fair at Cornerstone Church in Columbia on May 20th. Debbie will be there, and we'd like to have a TVIH table. So if you're interested in doing that, please reach out to her. So at this point, as a reminder, if you have questions throughout the program, please put them in chat. And then at the end of our speaking portion, we'll have a little Q&A. So I'm going to turn this over to Debbie. Thank you.
Thanks so much, Kate, for all that information about all the great things going on here at the Village and for hosting us this morning. We are so happy to have Congressman Sarbanes with us this morning. The Congressman represents the 3rd Congressional District of Maryland, which now, after this last election, now encompasses all of Howard County. So all of our members of the Village are represented by Mr. Sarbanes. He is appointed to the House Committee on Energy and Commerce and serves on subcommittees of Energy, Climate, and Grid Security, and the Environment, Manufacturing, and Critical Minerals. Mr. Sarbanes was born and raised in Maryland, lives in Maryland, and has that convenience of being and the benefit of being able to go home each and every day to be with family and meet with his constituents, hear from them, and we can hear from him. And we're just really happy that your office reached out to the Village. Just really glad that we can have this conversation and hear about all of the things that you were involved in Congress that help seniors not only just survive, but thrive, because our mission at the Village is for seniors across Howard County to thrive, aging in place, and just what we would love to talk more about. So thank you so much for joining us this morning.
Thanks so much, Debbie. I appreciate being here. And I was saying to Vicki a little while ago that I thought I knew a good deal about your organization, but that was a terrific overview from Kate with all of the amazing activities that not only keep the individuals that are sort of directly benefiting from them engaged, but altogether represent a contribution to the broader community, because when you stay active and you stay involved, it lifts up the entire community, in this case, Howard County. So I want to thank you for the good work that you do and for the clearly broad participation that you have. A few years back, actually, I was talking to a group of seniors, and there was all this research about this big wave, the baby boomer wave that was coming at the country, and all the analysts and sort of pundits were trying to determine and discern, what does this mean for the country? And I, in my mind, immediately went to the analogy of when I used to go to visit my grandmother on the eastern shore of Maryland during the summers. We would go down to Ocean City and go swimming in the sea. And there were 3 things you could do when a wave was coming at you. One was you could duck under it, which didn't accomplish a whole lot. The second was that you could sort of brace yourself, and it would typically just hit you and knock you over, which wasn't productive. The third is you've got to get a little bit ahead of it, and you start to sort of paddle forward, and the wave would lift you up and pull you forward. And I always thought that if we thought about this wave, this demographic wave that was coming at us as a country, and we prepared for it, and we rode that wave, and the civic engagement and the volunteerism and the activeness that it represented, it would lift us up and the country up and propel us forward. And so I very much kind of retain that perspective and that metaphor. I am newly representing, as was noted, a good portion of Howard County. I have represented parts of it for the last 16 years during my time in Congress, but as a result of the recent redistricting that occurred for the 2022 midterm election, and this will go forward, the 3rd district in Maryland now encompasses, as was mentioned, all of Howard County, which means that I no longer have to go through this exercise when I meet people in Howard County where we sit with a map for 10 minutes trying to figure out whether they're in my district or not in my district. If you're in Howard County, you are in the 3rd congressional district. So we can dispatch with that exercise that I've been going through for the last few years. So what it means is that not only are there a good many Howard County residents who are getting to know me for the first time, but I'm also getting to know them for the first time. And that means getting out, learning more about all of the amazing things that go on in Howard County. And I asked my staff to put together a list of the things that we've been able to do just in the last couple of months. And this is just a sort of highlight, but we've visited with Howard County General Hospital to learn about the work that they do there. And actually, I spent many years when I was an attorney in private practice representing Howard County General Hospital. Vic Broccolino was a close friend. Some of you may remember he was president of the Howard County General Hospital for many, many years. But understanding how the hospital is serving the county is very important. I was able to go meet with the superintendent of schools, and obviously what happens with young people is not just the concern of those young people or their immediate families, but it's an intergenerational undertaking to make sure that our next generation and our young people are getting a good, solid education. And we can talk about that more. There was a report released today on the state of civic education across the country. And unfortunately, the sort of knowledge and performance on that assessment has declined pretty significantly over the last 4 years. Some of that's attributable to the pandemic, which has had an impact generally on educational performance, but it may go deeper than that. So I did get a chance to meet with Superintendent Martirano here in Howard County to talk about efforts to reach out to our young people and make sure the investment of the Maryland legislature in the blueprint for education and that reform effort, that those investments are getting to the right places. Learning a lot about Ellicott City, which was not previously in my district, but now is. And of course, you know, the Safe and Sound initiative is to try to make sure there's resilience there in the future when it comes to these very severe weather events we're starting to see, I believe, as a result, in part, certainly of the climate change that we're experiencing as a country and as a world. So understanding what's happening in Ellicott City and other initiatives, frankly, that your county executive, Calvin Ball, and the county council are facing every day. And I certainly want to salute Calvin's leadership. He's a good friend. And also your delegation in Annapolis is working very, very hard to make sure that Howard County is benefiting from what we can get done in Annapolis in terms of the commitments there. Was able to meet with some representatives, the Horizon Foundation, which invests a lot of important resources in Howard County. Talk to people at the Howard County Economic Development Authority. Talk to the head of EcoWorks, which is doing a lot of green outreach in the county, and various other groups sort of on the ground and working across the county. So I'm starting to develop my own next level perspective on the good things happening in Howard County, and you're one of the good things that are happening in Howard County. So I'm just adding to that list today. In terms of my constituent services, I'll mention that we have moved because of the new district. My main office is now located in Howard County, in Columbia Gateway at 6751 Columbia Gateway Drive. That certainly makes it more convenient for residents of Howard County. We did send out, hopefully many of you received it. If some of you did not, we can certainly make sure we get those distributed. We sent out in the mail, a constituent services guide, which provides a lot of very good information, if I don't mind saying, about how you can access the services of my office. And I encourage you to take a look at that, and always feel free to reach out to my office for any assistance you may need when it comes to dealing with federal agencies, Medicare, Social Security, the Veterans Administration, et cetera. That's constituent services, one of the number one responsibility I feel I have, to make sure that we're always paying attention and doing everything we can to help people. We're not always successful, but to my mind, the standard is whether we give it our every effort, and we certainly do that. And we have an outstanding staff. Vicky's an example of that, Vicky Garcia, but we have certainly others that are in a position to reach out and support your needs. We also do, and some of you may have participated in this either in previous years or more recently, we do occasionally telephone town halls where we call thousands of people in an evening. We get them on the line, we take questions, and it's a great way to have an exchange. In a sense, we can view this as sort of a video telephone town hall, because in a moment I'm going to stop talking and would really just love to get any questions that you might have. But I did want to highlight a couple of things in terms of, now that I've spoken to the district efforts that we've undertaken. And just as an aside, just so you know, in addition to Howard County, the new 3rd district includes a tiny portion of Carroll County, and then a very large portion of Anne Arundel County, from Annapolis north, pretty much in terms of that county. So there's 770,000 residents in Maryland's 3rd congressional district, which is roughly the number, by the way, because it's what the Constitution requires, of residents in every congressional district across the country. And we go through a 10-year redistricting effort because the lines, the people move, and so the population changes, and you have to kind of redo it every 10 years to make sure that you have equal distribution. We have some good handouts that address a lot of different topics, and we'll make sure that we provide the one that I think we title Working for Seniors, and it really highlights some of the issues that are particularly relevant in things like, how do we keep Medicare and Social Security strong? What have we done more recently with the Inflation Reduction Act to reduce the cost of prescription drugs? And some of you know we've moved to cap out-of-pocket costs at $2,000 a year, which is a significant benefit for many seniors under Medicare. Also capping the cost of insulin at $35 per month, and beginning to negotiate to lower the cost of prescription drugs across the board, which we tried many years to do, but the big pharmaceutical industry, lobbyists and interests kept pushing back on that. We finally overcame that resistance, and we're making more progress, but there's still other things that we can do there, and I'm fighting every day on the Energy and Commerce Committee and the Health Subcommittee in Congress to make progress when it comes to lowering prescription drug costs. We've invested quite significantly in efforts at NIH and our other federal agencies to conduct the research that we need to do on longstanding and emerging diseases. so we have better insight into that, and we can find cures for those kinds of things. And of course, we want to make sure that we're protecting that important relationship between patients and their doctors. That's the most sacred, as if you will, connection that we need to safeguard when it comes to what happens in the healthcare arena. Recently, the cost of living adjustment for Social Security was quite significant in recognition of the inflationary pressures we've seen. It was an 8.7% benefit increase, the largest single year benefit increase, I believe, since 1981. So that was important to do. I'm taking steps all the time legislatively to support efforts to extend the solvency of Social Security, so you can feel comfortable that that program is one that you can depend on and that it will stay strong. And the last thing I'll just mention, because we know it's affecting older Americans, it's affecting families now much more significantly across the country, is the issue of food insecurity and making sure that people have access to the basic things they need in order to make it from one week to the next, from 1 month to the next. The guiding principle of my time in public service is to be honest, candid, and forthright about some of the big gaps that exist in our society. There are some who are quite comfortable and do very well. There are others who oftentimes are getting left behind. And as a public policymaker, I see it as my responsibility to always try to close those gaps. And I know the people on this call have a similar relationship to what our society should look like, and you're striving every day to bridge that gap and to reach out and support people. I guess the last thing I'll mention is my crusade for the last 10 years or more has been to strengthen our democracy. And I led efforts in Washington to assemble the broadest comprehensive package of democracy reforms called the For the People Act. It was HR 1. I did that over the last few years. We almost got it across the finish line last time. There were 2 senators that we just couldn't convince to change the filibuster rules to put it on the Senate floor. We can talk about that more if you'd like, but it would have fixed partisan gerrymandering, ensured access to the ballot box, made it easier with registration guidelines and voting rules and so forth to make sure people can cast their vote. It would have addressed the influence of big money in our politics, which is very distorting of how public policy gets made, unfortunately. And it would have insisted on ethics rules for members of Congress, the executive branch, and the judicial branch. And as we've been seeing over the last few weeks, having some code of ethics in place at that level and for that institution, the Supreme Court and other judges, is very, very important. So we're all committed to keeping our nation strong and addressing the gaps, the deficiencies, the weaknesses that we see, so it can be even stronger in the future. And I very much appreciate the opportunity to be with you. I'll stop talking now and we can turn it over to questions. Thank you.
Oh, thank you so much, Congressman. You've covered such a wide variety of topics in that little short time. I can't imagine what your day is like addressing all of the concerns of your constituents. I'm sure it's very, very full. But you mentioned at the beginning, you talked about the experience and the contributions of our members, and I just wanted to highlight that as well. I know I appreciate, as someone who's advocating for seniors, that just listening to you take into effect that folks who are over a certain age have had a whole story to tell, have an experience in the contributions. And just being here at the Village for 6 weeks, I feel like I can say is I'm amazed at this group of people just in this village. So to know that you represent amazing people here in Howard County. And talking about your interactions with the hospital. And one of the parts of the village that's important to us is caring for our members when they are not well. And I was just wondering if you could address that a little bit more about the healthcare accessibility. I think I saw something go by in the chat about the waits in the ERs and things like that. And how can we, I mean, how can we as a village help address that as well, make an impact for the community along with your
Well,
office?
for starters, your awareness of those issues, and I think anything you can do to sort of gather them into a perspective that can be shared with policymakers and community leaders, certainly with leaders in the healthcare arena in Howard County, but with governmental officials like myself and people at the county level and the General Assembly, so that we maintain a kind of collective high priority in addressing those issues. Because to your first point, there's so many different kinds of issues that bombard policymakers these days that you can have a focus on a Monday, and by Tuesday or Wednesday, something else is coming in and you have to shift your focus. And if you're not reminded that the Monday issue hasn't gone away and it's an important one, it can fall off the radar screen. So putting together kind of a list of primary concerns that you collectively have, with oftentimes maybe suggestions about what you think could be done about them, but keeping those sort of front and center when you're having interactions and communications with elected officials. I think that's a real contribution. Now, you have pointed to the ongoing challenge of trying to make sure we have all the resources flowing to our hospitals, to community health clinics, because providing comprehensive care can't just be investing in acute care. I mean, typically when people get to the hospital, they're getting there because they've reached a certain acute stage in terms of their healthcare need. Providing broad preventative care in the community, investing in primary care, community-based clinics and so forth is another really important feature. And it's something that I've spent a lot of my career focused on, particularly community health clinics. But one of the biggest challenges we're facing these days, and it can contribute to some of the wait times that you're talking about, along with sort of making sure that we have the right balance of hospital resources with community resources, is shortages in the workforce. And we're seeing that, to be very honest, with every category of the workforce almost in the country, whether you're talking about construction engineers at a time when we've invested all these dollars in building up our infrastructure, there's shortages there. There's shortages of cafeteria workers, bus drivers in our schools, teachers in our schools, but certainly nurses, doctors, behavioral health professionals, mental health professionals, they're social workers. The list really is almost endless in terms of where we have significant shortages in the workforce across the country. I've made a special project of addressing shortages in the healthcare workforce. And I've spent, 10 years ago, more than 10 years ago, I got a provision added to the Affordable Care Act, which would establish a National Healthcare Workforce Commission to look at these shortages and make recommendations about how to invest in them. And recently, we've been working with the Department of Health and Human Services because they collect a lot of data on these shortages, and they propose recommendations and solutions. Because we can invest all the dollars we want. And, under President Biden, we've invested quite a bit through the CHIPS and Science Act, the Inflation Reduction Act, the Infrastructure Act, our federal budget. But if we don't have people to actually go provide the services and do the work, then we're not going to deliver what we can to the society. So some of the issues and challenges you just referenced relate to the broader effort to balance where we direct our resources, but some of it also can relate to the shortages that we're facing in terms of just the professionals needed to deliver these services wherever they may be provided. And so we have to make that a priority and continue to invest in it. And when you're talking about skilled professionals, it's not something you can solve overnight. You can't just snap your fingers. You have to go out and train a whole new cohort of those caregivers and providers. So we have to invest in our universities and colleges, community colleges. Howard County Community College has terrific programs that can help with the workforce. So make sure that they're strong. Actually, I'm going to be visiting with the new president there. Well, she's not so new anymore, but I'm going to be visiting with her in the coming days and learning more about this very issue. So thank you for bringing it up, because again, it's not just an issue for the people on this call. Health affects every member of an extended family. If you're feeling, if you have a sense of confidence that a loved one is being cared for or is able to access their health care when they need it, that sense of confidence and calm permeates the whole family. But the reverse is true as well. If you have anxieties there, then everybody who's part of that extended family is affected by it. So, you know, there's a reason we put so much focus on health, you know, as a value really in our society.
Oh, absolutely. It does affect the whole family. I can attest to that. I appreciate you saying you're going to be meeting with Howard Community College soon. I actually have a meeting this afternoon with a group from the village about programs there working together with the village. So it's
Excellent.
a joint effort. And you did mention constituent services before, and I did want to acknowledge that we have reached out to your office, and you all have been very helpful and responsive for a couple of the issues of confusion with the IRS and Small Business Administration. So I do want to say thank you for answering those concerns that we've had. Kate, do we have I know we have questions going by. I don't want to take up all the time with my questions. So what are member?
Well, as an add-on to the question about healthcare, Stephanie is wondering, as Medicare supplemental premium costs are becoming unaffordable for some plans, more than $3,000 a year, could increasing original Medicare benefits be considered to offset some of these costs?
I think that's a very fair question, and it needs to be a topic that we look at as policymakers broadly. Because as we know, I mean, Medicare provides a tremendous amount of benefits to our seniors, but the seniors themselves and their families do participate at some level in the kind of financial dimension of how the total care package is brought to bear, whether it's through co-insurance under certain circumstances or co-payments, whether it's these Medicare supplemental plans that sometimes people buy to cover those co-payments and other things. But we always have to keep an eye on the market that's delivering these plans and sort of supplemental gap coverage, because the tendency, if they're not watched carefully and if there aren't some strong kind of regulations in place, can be to in certain instances, they may kind of lean towards being exploitative, and we have a responsibility to make sure that that's not happening. So there's a kind of enforcement of standards to make sure that those private parties that step into the Medicare arena, and that can include, for example, Medicare Advantage plans. There's some evidence that some of those Medicare Advantage plans, which many of our seniors are part of, may actually be taking advantage of our seniors in ways that is not fair. So we have to keep our eye on that. So that's just kind of that's sort of the consumer protection side of how we manage the Medicare program. But the other thing is to consider, when does it make sense to broaden out some of the benefit coverage that's offered through the Medicare program to cover some benefits? For example, dental care is not covered at the levels that I think many seniors would hope and anticipate. Do we need to be taking a look at that. Are there other kinds of care and benefits that we can deliver through the Medicare program? Always being careful to be sort of fiscally prudent about the program, because you don't want to so overburden it that it can't provide its base services, its core services. But certainly there are expenses that our seniors have in the healthcare arena, where examining the potential for Medicare to broaden out its benefit package is fair. And a lot of times what we've discovered, particularly when it comes to preventive care and primary care, is that $1 invested at that point in the continuum can save you dollars further down the line. So it can make financial sense, and it should make financial sense when we look at these investments in terms of the benefit package that we offer to our seniors. And that, rest assured, is an ongoing topic of conversation, focus, hearings, and research that we do as policymakers in Washington, because, you know, the Medicare program is so critically important for our families across this nation. We need to make sure that it works well, that it's efficient, and it's providing the care that it aspires to provide, and certainly that lawmakers would like to see it provide.
I love that you're keeps bringing up prevention, preventative medicine and primary care. I know one of your initiatives is about food security and nutrition, and those two things together would go so far into that preventative arena. I was wondering if you could address that maybe a little bit more.
Well, absolutely. I mean, the research isn't recent on this. It's longstanding. It's just a matter of, you know, do policymakers ultimately pay attention to what is being shouted at them by the research every single day? But if you invest in prevention, if people are eating nutritious meals, obviously that's going to benefit them in terms of the kind of baseline of healthcare that they have. If the interventions you make when somebody begins to have a health issue are earlier rather than later, you're not only going to save money and resources because they don't get sicker, it's just better for those individuals. The other interesting thing that's happening, and in some ways our seniors are very much on the front lines with technology, is that we're investing more and more in technology that allows seniors themselves to kind of monitor their own health conditions, check their blood pressure, you know, make sure that they're managing a diabetes condition if they have it themselves in a more effective way, and then obviously interacting with their doctor to make sure that comprehensively their health is being treated as it should. But in that sense, seniors can become part of the caregiver team that is providing services to themselves, which is an interesting concept if you think about it, because it's empowering and it gives our seniors agency to be involved in their own healthcare. I mean, obviously, they're not skilled healthcare professionals themselves, but they can learn enough about sort of the basic preventative steps that they can take, and then use some of the technology that's available to help them with that. And then as a team working with your doctor, you're better managing your care, and that extends to nutrition, extends to physical fitness activities. It extends to social interaction, which we know is certainly important to address, you know, loneliness and sort of mental health issues and stress and so forth. Actually, I just read, some of you may have seen it, that the Surgeon General of the United States has identified loneliness as one of the most significant sources of stress that we're feeling as Americans. He describes his own bout with loneliness. And we know that there's a whole area of research and study and awareness of how loneliness can present challenges for older Americans. And what can we do to address that? Coming together, shared activity, it's all part of us connecting to each other as human beings. And that can provide a great source of comfort for each of us, and again, for our extended families, knowing that connection is there and is in place. So we're living in a time where technology can be beneficial in the ways I described. It can also, even though often it's marketed as bringing people together, sometimes it can present new levels of stress. So we got to achieve the right balance with our use of technology, but then leaning back on some of the old-fashioned things, like actually, being with somebody in real time. And I very much am a believer that, and you mentioned some of these activities, that when you get people out into nature, it has a soothing effect. It's very beneficial for people, whether it's older Americans or it's our young people. Getting children into nature has shown real benefits. And particularly now, it gives us a break from sort of all of the technology and devices that are bombarding us every single day. So we need to achieve and hold on to the right balance in terms of those inputs that affect our sense of self and our sense of comfort. And if we can do that, that builds a stronger, better, and I think ultimately more compassionate society.
You have just hit on one of the key elements of the village and the benefits of the village. I was going to say first that there is research showing that members of the village organizations, there are villages all across the country, can actually, and like I said earlier, the goal is for the people to be able to age in place successfully, and how the village concept, people being involved, allows folks to live at home for more than a year, longer than average. And while a year plus may not sound like much, it's a huge benefit to the family, to the individual. Just this program that we're doing right now actually came out of COVID and trying to prevent isolation. It started out, my understanding was 5 mornings a week. Our members would come into Zoom. Hi, how are you? Keep check on each other, kept that activity going from very early in COVID, so which has allowed the village to really thrive throughout COVID. And we still have a lot of our virtual programs, but getting back in place. So it's one of the things I love about the whole concept.
It's terrific. I before I was in Congress, I spent 18 years as a healthcare lawyer, and my niche practice was representing senior living providers, healthcare providers that are focused on older Americans. So I'm extremely familiar with all of these efforts of the kind that you're describing, and the tremendous benefits. And when you do come in and they do these research studies according to all the various protocols that are needed to meet the standard, they absolutely determine that the physical, the mental health of those who participate is improved by it. And so maintaining those connections, establishing them where they're missing, is one of the most important things that we can do. And if you participate in a class or an activity or a discussion with your congressman or something, that's something that can be the basis for 2 or 3 conversations for the rest of the day or the rest of the week. And that's what we're striving for as people. We only have a certain time on this planet, and we sort of have to maximize it. And that's part of how you do that. So
absolutely. Kate, will you please share some other questions that are in the chat?
I will. And speaking of time on this planet, there is a major climate bill that someone has asked about, and that has to do with it's the electrification requirement for new buildings in Howard County. I understand that in DC and Montgomery County, these have already passed. As we mentioned earlier, there was a program on housing options for seniors. So I think an understanding of where we are in terms of climate as well as building changes would be helpful. Could you speak to that, please?
Sure. Well, I'm glad you brought up the environment, because among the sort of 3 or 4 top areas of focus for me during my time in Washington has been the Chesapeake Bay, but beyond that, just making sure we're doing right by our environment. I'm the author of something called the No Child Left Inside Act, which is the notion, as I referenced earlier, that when you get young people out into nature, it shows all kinds of benefits. It's good for their physical and mental health. It's good for their proficiency. I mean, their achievement goes up because, again, it's the balance achieved and the different kinds of ways you can learn when you're connecting to nature and having that experiential learning has been shown to be very, very beneficial. But maybe the most important thing is it creates early on the interest in the environment and nature and turns young people into stewards. It directs them into career paths where they can really become stewards of our planet and our environment. So that's been a particular focus of mine. But broadly speaking, undertaking everything we can to address climate change, whether it's looking at some of these technological solutions to, are pulling carbon out of the air and sequestering it, or biological solutions, which I'm very interested in, what plants can do to sequester carbon, to address the excess emissions we have in the atmosphere. But of course, taking the important steps on the front end, which is to reduce our emissions, which we do with more energy efficient and clean cars and production facilities and home appliances and so forth. And as you know, the Inflation Reduction Act, along with, frankly, the infrastructure bill that we passed, invest a lot of dollars in those kinds of efforts, cleaning up our act, basically, so we are reducing the amount of emissions that go into the atmosphere. Part of that is what you referenced, which is sort of electrifying our infrastructure. And that's looking at when new buildings are being constructed, what does it mean for those buildings to be part of the solution and not part of the problem? I'm very much, and that's a combination of how those buildings are powered on the one hand, and then the conservation and efficiency measures you take on the other hand. So local governments, as you pointed out, are looking at what they can do in terms of the requirements for new buildings. I've been looking very closely, and I've actually helped to draft legislation in Washington on this topic, at how we can look at the entire infrastructure of the federal government. And if you think about it, and this is certainly the case in Maryland, there are a lot of buildings owned by the federal government. And thinking about how to green those buildings, make them more energy efficient, which can result not just in savings when it comes to their impact on the environment, but actual financial savings if you look at efficiency and so forth. All of these things have to be part of the solution. And so, but one of the biggest challenges we have is we can move to the we can move to more energy efficiency, electric vehicles, electric buildings within the definition you might put there. But then we got to make sure that the source of electricity coming into our grids is itself clean and renewable. This gets to, for example, many of you have been maybe following this in the news, Maryland's recent decision to invest even more in offshore wind power. because that is a clean, renewable energy. And it means that the power you're bringing to the electric grid, which you're then depending on in terms of these other initiatives, is coming from a clean source. You wouldn't be solving the problem if you created more electrification opportunities in the society, but the source of that electricity was still dirty power. So we have to make these transitions at all stages. And I think Maryland is going to be a real leader when it comes to pursuing renewable energy, whether it's solar power, we're seeing more of that happening in Maryland, or this significant commitment to offshore wind as a source of renewable energy. And there's no time to waste. The 2,000-year storms that hit Ellicott City over a period of 4 years demonstrates that this violent weather is going to become much more common as we move forward. And we don't know what that critical tipping point is when it comes to the environment and to the planet. But we've got to make sure we do everything we can to avoid it. Unfortunately, as you know, humans are not great at making decisions today about things that could happen next year or 5 years or 10 years from now. We're not particularly good at that as a species. And that's a challenge for us, because certainly the research from our scientific community is there to tell us without equivocation that global warming is happening, and that if we don't take dramatic steps soon, we may not be able to outrun it. So I appreciate the interest, because this has to be an all hands on deck effort. People of every age in every community have to find ways in their own lives and with their own habits to do things that improve the environment. And then certainly if you and I and others are taking those steps in our own orbit, within our own peer group, within our own footprint, we have every right to demand that our policymakers, like members of Congress, members of the General Assembly, are undertaking collective efforts and making broad investments that mirror that kind of commitment. If we do that, again, collectively, I think we can have the positive impact we all seek, and hold on to this wonderful, beautiful planet, which, without that, none of these other public policies, amount to a hill of beans, I guess is the expression. So.
Well, thank you. That was a very complete answer, and we appreciate it. And I appreciate you talking about the offshore wind initiative. But also, we know that we live in a very congested traffic area. And there is a question about what influence you could have on improvement in public transportation in Howard County. Many older individuals as well as commuters would appreciate a more easy on-off public transportation within Howard County and maybe into some of our surrounding areas.
It's a great question. Another area of real interest for me. And I have worked over the last few years to invest in the rapid bus transit line that's been created along Route 29 between Howard County and Montgomery County. Those actually also are energy efficient and clean buses, but it also is an opportunity. It's a form of mass transit and public transit that's very important. I think we need to look at how to expand those corridors, and I know that the county executive and county council are focused as well on trying to improve public transportation in Howard County. I think we need to invest in that as a country more than we do. I do think the new governor of Maryland is seeking a better balance between investments in public transit and just building new roads. And because, some of you may know this, but they do studies, let's add another lane to a 3-lane highway. But to relieve congestion, but there's a dynamic at work, and I'm not enough of a sort of planner to understand exactly how this works. But the bottom line is if you add another lane, people just, over time, it creates more congestion because the expectation of what the road can offer you in terms of convenience shifts to accommodate it very quickly. So I don't think the answer is just to keep expanding the width of our highways and the amount of asphalt we put down. I think we have to balance that with significant investments in public transit. I've always been a keen believer that we should improve the marked commuter system in this area. It could be a very state-of-the-art regional transportation and transit system, and it could then connect better to other modes. You know, we talk about multimodal transportation. How do we put trains and buses and cars and bikes and so forth? How do we connect those all together so people can get from one place to the next, do it in an energy efficient way, a time efficient way, and a way that doesn't have a significant negative impact on the environment? We can achieve this, but Americans' love of the car and the automobile can present challenges at times. And getting from here to there, like we can all envision a public transit system that's very interconnected and multimodal and would work if we could snap our fingers and get it. The problem is you can't snap your fingers. So in the meantime, you just want to get in your car, if you even have one available to you, and solve your transportation challenge that day using your car. So how we build these other systems in place so we can kind of get people to make that transition or choose more wisely about which transportation modes they use is a challenge, but I think one that can be overcome. And frankly, places like Howard County can be, as Howard County has been in many respects, a model for how you take on these challenges and overcome them. So I think it's a very important thing to keep in front of policymakers, whether it's myself at the federal level or the local and state policymakers, because transportation affects quality of life. We know that. It takes me 2 hours sometimes to go 50 miles from my house to get into Washington, because the Baltimore, Washington area, according to studies, is one of the most congested commuting regions in the entire country. So we're certainly dealing with that every day, and Howard County feels it as well.
Thank you so much, Congressman. We want to be respectful of your time. We have 2 minutes left before 10. I was wondering if there's any, just appreciate you so much coming to talk with us.
Yeah.
If there's anything you'd like to leave us with?
I just want to thank you for many of the reasons that we've already touched on today, but having these interactive conversations is really important for me as a policymaker. One of the benefits I have, you noted at the outset, I think when you're sort of reading my short bio, that being able to come home every night to my district certainly serves me well personally, because I can get back to my family. And I know that many of my colleagues, one of the toughest things for them is when they go to Washington for the week, they have to leave their families in the district. They don't see their kids, they don't see their family and so forth. And that's very tough. I have the opportunity to come home and get out of the bubble of Washington. But it also means I get to talk to my constituents really continuously every day. And that's a huge benefit to me, because you can get kind of isolated or insulated or cocooned inside the Washington mentality. And if you get too far afield from the real life challenges that your constituents are facing, you're going to make mistakes when it comes to public policy. So these kinds of interactions, and then obviously meeting people in my district as I move around, helping with constituent casework and challenges that people bring to us. I think it's what keeps me effective as a public policy maker. And I benefit tremendously from that interaction. I'll close with this observation. And it's premised on my hoping that what I do every day is to try to govern well as an elected official. But my father, who, as you know, was in politics for many, many years, I'm sure there's people on this call who voted for him on a number of different occasions. But he always used to say that he thought that one of the most important sources of quality of life by people was feeling that they were being well governed. And I think what he meant by that is if you get up in the morning and you feel like the people that you've elected and the people that are in positions of responsibility are doing a pretty good job, or at least, you know, trying their best, you start your day in a more positive frame of mind than if you get up and you feel like there's a bunch of crazy people running things, which has you on edge. And without getting too specific, I'll just say we went through a period of 4 years where before breakfast, there was certain communications coming from one of our leaders that had us all on edge before the day even started. If you don't feel well governed, if you don't feel like things are being cared for and paid attention to, that affects your day, that affects your week, that affects your sense of quality of life. So there's many things that contribute to quality of life. We've talked about many of them on the call today. But among them are a sense that your elected officials and your community leaders are in the jobs for the right reason, are trying every day to make a positive difference in your life. And that can help contribute positively as well. So it's a two-way street. I benefit tremendously from these conversations. I hope it's of value to you all, and I thank you for the good work that you do in connecting your members to all of these amazing opportunities. I won't say that talking to me is necessarily an amazing opportunity, but there's many that you offer. So anyway, thanks very much for the chance, and look forward to doing this again in the future.
Oh, that would be fantastic. Thank you so much. And I hope you have a wonderful day.
All right. Take care. Bye-bye.
You too. Bye-bye.
Yeah.
Kate,